It is, I guess, 12:01 on my end and 3:01 for those on the East Coast to talk about sustainability for our um, Safer Childbirth Cities. And just talk about the Safer Childbirth Cities initiative in general. This webinar series is called Pathways to Sustainability, and I am kicking it off on behalf of the Association of Maternal and Child Health Programs. So let me next slide, please. My name is Janina Ong, and I'm a program manager here at AMCHP. Today's agenda is that we will talk a little bit about the Safer Childbirth Cities and AMCHP's role in convening a community of practice, as well as the Sustainability Grant Program. Then we'll talk about a large overview of this program and what our aims were. And then we'll discuss a few of the funded grantees and then talk a little bit more about this webinar series. So, we're really excited to share this with you all because community-rooted organizations have substantial evidence that their programs and services are effective at protecting positive birth outcomes for the Black and Brown families that they serve, and in many cases, reduce and eliminate racial disparities. So we believe that their solutions should be a priority in any public health agenda, as communities are experts on their own lives and challenges. Next slide, please. So I want to give some background information for those of you who are not familiar with the Safer Childbirth Cities initiative. The Safer Childbirth Cities initiative was launched in 2018. It fosters local solutions to help cities become safer and more equitable places to give birth. They are funded by Merck for Mothers and a circle of co-funders. The cities funded are community-based or community-rooted organizations in the United States, particularly in cities with a high burden of maternal mortality and morbidity. The cities were selected for their programming and solutions that work towards reversing the country's maternal health trends and directly tackling racial inequities in maternal health outcomes. So you'll see 20 cities on this slide here, and 10 cities were funded starting in 2018, and their funding had just come to an end. And then another 10 cities were funded starting in 2021, and their funding is coming to an end, I think, next year or this year, sometime between now and then. You can learn more about the Safer Childbirth Cities initiative at www.saferchildbirthcities.org, and I could put that in the chat for everyone. I want to tell you a little bit about AMCHP. Next slide, please, Salome. The Association of Maternal and Child Health Programs, or AMCHP, as we lovingly call it, our mission is to advance the health of women, children, youth, families, and communities by strengthening governmental public health and deepening community partnerships through a health equity lens. Since being founded in 1950, AMCHP has served as a national resource partner and advocate for state public health leaders and others working to improve maternal and child health public service systems. So many of the attendees today here would know AMCHP because of the work and technical assistance that we have provided to states. And if you don't know about us, please check us out at www.amchp.org. Particularly our role, back please. Our role in the Safer Childbirth Cities initiative has been since 2020 to convene a community of practice for the grantees to come together. And then this year we launched a sustainability grant program. But the community of practice for the last 3 years that we have been hosting is a space that we have created both virtually and then in person when we're able to meet in person for the grantees to talk about their shared challenges, their shared solutions, and align together on what they're working on. We've also brought in experts to help them focus in on certain aspects of their work that they needed assistance with. The Sustainability Grant Program, which I'll talk more about today, has several objectives. So the reason why we developed this program and partnered with Merck for it is because we were hearing from a lot of the grantees that in the 3-year time span of their grants that there were some unfinished or uncompleted projects that that they would love to take on or complete because They just didn't think that at the end of the grant period, they were set up to continue their programs or interventions sustainably. Part of that is due to the fact that in 2020, a lot of the grantees had to pivot because of the pandemic and had to switch around their programming or had to immediately move from in-person programming to virtual programming. And that shift took a lot of time and energy. So for us, we really wanted to work with the grantees towards sustainability of their programs and the initiatives funded by the original grant, so that the organizations involved could build more community-defined evidence and continue to provide essential services that will close disparities in maternal and infant outcomes. So, the original funding was transformative for their operations and how they serve their families in their cities. But at the same time, they had to pivot. And for this reason, we developed this grant program. There are a few objectives that we had in mind, and they were to provide targeted goal-based funding to overcome sustainability obstacles faced by grantees, either individually, in groups, or collectively. Support grantee goals for sustainability, including creating definitions, processes, timeframes, and to identify collective targets to increase likelihood of sustaining grantee innovations. Our third point was to harness existing skills of the grantees to provide lessons on sustainability, so learning from one another. And then finally, we are working on doing these webinars as part of this one, but engaging Title V members and AMCHP's connections on how to best support community-based organizations and sustaining programming and interventions through these webinars. So my next slide, please. AMCHP defines sustainability across several domains. For instance, sustainability can be achieved by institutionalization of a program within an organization, continuing benefits or improved outcomes for the key populations served by the program, maintaining the capacity of those helping to implement the program, continuing to maintain attention to the issues addressed by the program, even if the program doesn't continue. So I think for a lot of us, we might jump to the conclusion that sustainability, equals continued funding. And in a lot of the cases it does, but I think that there are other domains that we have been pointing the grantees towards to think about in regards to building that sustainable pathway. They are listed here on this slide, and they are continuous quality improvement and evaluation, benefits to the community and users, stable funding streams and financial resources, organizational characteristics such as structure, climate, culture, and resources, program adaptability, contextual and environmental fit, and then lastly but not least, active and communicative partnerships / relationships with collaborators across the community. And then I want to go into some of the details of the grant program. Because we had heard, next slide, please. Because we had heard from many grantees that application processes can be tedious and, often for very little payout, sometimes they don't receive the funding in the end. We wanted to make sure that we were extending trust, flexibility, and maintaining a low burden when it came to our application process. We were funding two types of projects. So one project was either a clearly defined project in which the grantee had an activity that will impact directly the sustainability of their efforts. And then the second project was one where two or more safer childbirth cities collaborated towards a defined goal or product that will enable sustainability. So we made this announcement in January about these applications. We provided multiple office hours as well as one-on-one support. So we didn't we were very clear and transparent about what made a good application and what we were looking for so as to not waste people's time or energy and effort. We were very clear in our one-on-one coaching sessions that, whether that project was a good fit for the funds that we were providing or not. And then if they weren't, we would provide alternate methods of them providing proposals that would. We had a rolling deadline that allowed people to get their proposals in early and have them reviewed early in case we had additional questions. And our final deadline for proposals was May. first. And then from there, we contracted with the projects, and those projects are currently running now, and they either run for a length of 6 months or 12 months. In terms of accountability and maintaining a low burden, we're only having them check in with us for a midpoint and a final report. The application, again, to maintain our low burden and to be very transparent with what we needed in order for us to score the application, really only consisted of 5 questions. We asked people if they were part of a community-based organization or not, because we really wanted the funds to go towards community-based organizations. We asked them for a detailed proposed plan. We asked them for their timeline and budget narrative. And then we asked them, what does success look like for this project, right? Because we wanted to make sure that whatever they were putting into this project and whatever outcomes they had a direct correlation towards sustainability. And sometimes if they didn't have a direct correlation towards sustainability, we made sure to work with that grantee and talk to them and coach them towards products or outcomes that would clearly define their pathway towards sustainability, which I hope you'll hear more about in our series today, starting today. So for type 1, we did ask them what kinds of barriers did they have to achieving this project prior. And then for type 2, we did want the collaborators to clearly demonstrate who would be taking on what role, how it would be an equitable project, and how they would decide in terms of intellectual property. Next slide, please. We received 19 applications, and we were able to award 13 grants, of which the highest was $50,000. We only had 1 application for a collaboration project, and we also had been able to fund that project. The project types really varied. They varied from hosting events, 1-day conferences for birth workers or 2-day summit for the community members and families that they work with, to course creation. So creating a course for doulas, which I think you'll hear about today from our Tulsa team. And then, finishing evaluations and reports, as well as other trainings. Some highlights of the grantees that we were able to give funding to. In DC, Mama Toto Village is developing an advocacy and policy training. New Orleans Institute of Women and Ethnic Studies is revitalizing their This Is Why campaign. It's a campaign that highlights community voice and incentivizes partners who collaborate and engage in their action network. Black Women's Blueprint in Brooklyn is conducting an evaluation project that consists of listening sessions, co-design, and data sharing with the community. And throughout this webinar series, you'll hear more about some of the projects that we have funded, but really this is the work of the grantees, and we're just really here to support them through that. Next slide, please. In terms of the support that we are providing, we do know that funding is a constant concern. So one thing that we know is that sometimes it can be hard to find funding opportunities. So our team has been developing monthly funding digests, so that grantees know, what kind of funding they could be eligible for and have more targeted approaches to putting in proposals. We are also partnering with a nonprofit consulting firm, Marshall & Marshall, to create workshops for the grantees, to talk about various aspects of sustainability and what is most concerning to them at this point. And then finally, we are offering technical assistance, not only on fundraising, but also on subject matters in regards to specific topics. So if they are interested in, for instance, substance abuse disorder, and they haven't had that expertise before, we'll connect them with somebody at AMCHP or somebody within the Safer Childbirth Cities network in order for them to better understand that topic and grow their expertise there. So I'm really excited to talk about, what's upcoming in our webinar series. Today, you'll hear about investing in the longevity of the doula workforce from Tulsa Birth Equity Initiative. Next week on Tuesday at the very same time, and if you didn't register for all in the series, but you're interested in this, please register. We will talk with, EverThrive Illinois will present on developing a community engaged communications campaign, which is very interesting. Then the following week, we have 2 grantees, the Jackson team and the Pittsburgh team will be discussing their two projects that are separate. One is on like birth work, cultivating a space for birth workers, and then another is about training community advocates. And then on October 31st, Halloween, Reach Up from Tampa, and then Urban Baby Beginnings from Norfolk will be talking about their methods to evaluate and document the impacts of doulas, which I think is very exciting because you get it both qualitatively and quantitatively from the groups.